This is a 3.5 mm right-angled dissecting forceps. It is ideal for accurate dissection and isolation of blood vessels or for dissection of other fine tubular structures. This is a 3.5 mm blunt grasping forceps with an atraumatic and fenestrated blade. It gives one a very firm grip and very nice and gentle tissue handling. The hook scissors, of course, is necessary for cutting sutures or when one needs to cut through very tough tissues. For some special operations, one would need specially designed instruments. If you are doing a pyloromyotomy for pyloric stenosis, then you would absolutely need this set of instruments. This is a 3 mm pylorotome with a guarded blade mounted on a U-spring handle with ratchet. The blade can be protruded in gradation. With this blade, you can make the first initial cut for the pyloromyotomy incision all the way down to the mucosa. And following the initial cut by the pylorotome, you can then plunge this pyloric spreader in through the cut and proceed with the pyloromyotomy by spreading open the pyloric tumor. This pyloric spreader has got serrated jaws on both sides of the blades and allows very effective spreading of the muscle mass. And once you have spread open the pyloric tumor, you can then complete the pyloromyotomy with this pyloric spreader, which can be inserted into the peritoneal cavity percutaneously. You can see that the blades can be opened very widely, thus allowing very effective spreading and opening of the pyloric tumor. And if you do it right, actually the whole pyloromyotomy operation can be finished within around 15 minutes. For inguinal hernia in neonates, infants and children, I've been using this hook that I designed back in Hong Kong, and now Yeung Storz is making it for us for the past over 12 years. And this is again a very, very nice instrument that I will take some time to introduce to you. As you can see, this inguinal herniotomy hook dissector has got a curved blade with a smooth curve. Of key importance is that the tip is specially designed in that it is fine and tapered, but not very sharp like a needle. The thin and tapered tip of the blade allows the hook dissector to glide smoothly in the extraperitoneal space just beneath the peritoneal layer of the hernia sac. The hook also allows the peritoneal layer to be easily lifted off the vas deferens and the spermatic vessels, thus allowing a complete circumferential 360 degrees dissection of the hernia sac of the surrounding tissues. At the tip of the hook dissector is an eye for carrying the suture, which of course can be used to close the hernia defect after complete dissection of the hernia sac. Now I would also like to introduce to you some of the laparoscopic ports that I use commonly for my laparoscopic operations. One, of course, also need to use for more common operations the reusable ports, all right, that will, of course, reduce the cost of the operation and the consumable substantially. This is a 3.5 mm port, a reusable port which will allow the use of 3 mm instruments very, very nicely. And this is a 3.9 mm port, again reusable, and with this one can use up to 3.5 mm instruments very comfortably.